No, actually innovation is a combination of technology, model, one more process. These three we have to include, and for which we have to include all this technology, innovation and everything, and we have to make. What is your objective? What is your objective for innovation? To make our healthcare outcome and delivery perfect. Why we are talking about innovation nowadays? What is the reason for innovation? What is the reason we are talking about innovation? What is the reason we are using the technology? What is the reason why we are renovating the method? What is the reason we are renovating the process? What is the reason? Number one, rising costs. Why the rising cost is happening? Aging population. What is why aging population is increasing? And automatically aging population, they expected prolonged treatment, prolonged care, because nowadays medical field that cure to care concept is happening. It is not cure. We are talking about care, only care. And we are not going for the hospital for treatment. Why we are going for the hospital? We are going for the hospital for improving our quality of life. So the expectation of the patient is also increasing. The demand transformation also there. The aging population numbers are also increasing. And for your information, 70% of the healthcare spending is for chronic illness, chronic disease. 70% of the healthcare. So automatically it is increasing of cost. So for fulfilling the demand gap, we are talking about this innovation and how this innovation works. I am giving the overall overview of what is happening in the world. What is happening in the world? Actually, I am going to talk about your innovations in healthcare operations as well as innovations in your patient care. So, healthcare operations, what are the changes are happening? In a broad spectrum I am talking. What are the changes are happening in healthcare spectrum? Healthcare operations, one is digital transformation. Another one is smart infrastructure. Another one is supply chain logistics. These three things are happening in your healthcare operation, that is hospital operation. One is digital transformation, smart infrastructure and supply chain logistics. In a broad heading I can elaborate you. Digital transformation, it includes EHR, that is electronic health record, HIS, hospital information system, and AI, that is artificial intelligence. What are the EHR, specific EHR is happening here? What are the, actually the tomorrow clinic, they are using Epic system. Epic system, that is AI powered Epic system in their EHR, and Cerner Million, that is another one of the powerful EHR systems, Cerner Million. That's a cloud-based EHR that is used by even our Apollo Hospital is using that Cerner Million AI for EHR. Another one is fast healthcare interoperability resources, that is FHIR. These three are the leading EHRs we are using in the world. And the next one we have to talk about the HIS, Hospital Information Systems. What are the information systems we are using nowadays? One is SAP. SAP for Healthcare Enterprise-Wide Hospital Management with Analytics. John Hopkins, they are using this SAP Enterprise-Wide Hospital Information System. And Meditech Expanse, that is a cloud-based HIS that is used at our Narayana Hospital, Narayana Health in India. And another one is All-Script Sunrise. That is also advanced HIS in decision-making system. Like decision support features, they are using that All-Script Sunrise HIS is Hindi. HIS systems are using. Lot of HIS systems are there. I'm talking about the transformed HIS system I'm talking about. And the next one is AI, Artificial Intelligence and Administration. What are the artificial intelligence we are using here? One is Azure. A is the URE. Azure. There is Microsoft company, they are using Azure. This is AI, Artificial Intelligence. This is used by NHS UK. Actually, they are having a very complicated system in the public health in UK. This Microsoft Azure, this is minimizing all the things. And DeepMind, this is the Google DeepMind system, that is AI. This is a predictive model for resource allocation. And another one is UiPath RPA plus AI. This is the system used by Apollo. This is what it will do. It automates repetitive administrative tasks and billing tasks. Suppose billing time will be there in the sense, it will automatically generate. So it will minimize the discharge delays and that. So these are all the EHR, HIS and AI used in the healthcare operations. And the next one I want to talk about the smart infrastructure. Smart infrastructure in the sense what we have to use. One is smart bed. Everybody knows that. Monitor, patient movement and pressure vital, the bedside things are there. Cleveland Healthcare, they are using very effectively the system. This is IoT based, Internet of Things. Then another thing is connected infusion system, connected infusion pumps. This is used by Apollo. Connected infusion pumps. What it will do? It will prevent dosage errors. One question asked in the students' presentation, how medical error will be reduced? Actually, this connected IoT infusions that will reduce the dosage error, that is also used in Apollo. Another one is IoT asset tracking. What is this asset tracking? Using RFID, that is radio frequency identification, and Bluetooth. It will track the equipment, where that equipment is moving, everything is tracked under this IoT asset tracking system. So these are all the things what is using in the innovations in the hospital operation, that is under smart infrastructure. That is another thing is happening, that is robotics. Robotics under robotics, drones, everything is there. Robotics also used for the operation side, that is RPA boards. That is automate billing clients, everything will happen. That is Clinic is using that. And service robots delivering medicines. That is robots delivering the medicines. Fortis Group is using that service robots. Why I am mentioning the name of the hospital or the medical group? If time permits, lot of students are there. You have to visit that particular structure over there whenever you are going for the hospital visit or you are going to visit the hospital setup. Because at least in India. And a surgical robot assisting precision in surgeries. This is John Hopkins, USA, they are using this system. And innovation in hospital operations, what is the third one? That smart facility monitoring and energy system. This is the IoT based HVAC and air quality sensors. That is, in that particular hall, the air conditioning level is okay, that the pollution is there. Everything it will be monitored. They are using that smart facility monitoring and energy system. And one more thing is there, smart lighting and power system. This is again NHS UK, they are using this system. It will reduce the cost. That suppose lighting is not needed, it will switch off automatically. That smart lighting system is there. Then one more thing, simulates hospital operation for planning and efficiency. So this is called digital twin technology for the planning as well as the efficiency of the system we are using. So that is called digital twin technology. This is used by Shiva Medical Center, Israel. And third one is for supply chain and logistics. Supply chain and logistics we are talking. That is one is AI driven inventory management. Everybody knows about inventory management. For inventory management, proper predictive analysis is needed. Automated reordering system should be needed. Then that is happening at Mayo. That is for inventory purpose they are using. For inventory purpose, supply chain and logistics, they are using drones and autonomous delivery system. That is one is medical drones. Even in Rwanda and Ghana, they are using the chip line model. That is only the drones that will supply the medicines for the people. And in AIMS they are trying for that as a pilot study. They are trying for that this supply chain system. And the third one is blockchain for supply chain. What is the blockchain? BLOCK, blockchain. Track mechanism for manufacturers to patient. Manufacturers to patient or customers. Track medicines from the manufacturers to the customers. It is manufactured till the end of the customers. What that particular medicine, what is happening for that medicine. It will be tracked. That is the blockchain system. That is the smart control over the purchase agreement. This is controlling on the purchase agreement. See, these are all things are concentrating on the administrative aspects. Purchase agreements, even compliance, everything it will be. Now this kind of blockchain technology they are using in FDA USA. And medical ledger project, that is also in USA, they are using this blockchain smart contract system. Smart contract system in the blockchain they are using there. This is happening in your hospital operations. What will be the patient care? What is happening in your patient care? Everybody knows that patient care, it is under, again it is under 4 areas: precision medicine and genomics, telemedicine and remote monitoring, AI in diagnostics and treatment, patient engagement and experience. In these 4 areas, we are using the innovation by this technology, that is precision management and genomics, telemedicine and remote monitoring, AI in diagnostics and treatment, patient engagement and experience. What is happening in the precision management? Precision medicine. What is precision medicine? It is tailoring the treatment. How our genetic makeup will be there, based on that, the doctor will tailor the treatment. How the treatment has to be given. This is called precision management. This is happening in the innovation. Even in the patient care, this is happening. This is also happening in Mayo, USA. Another one is clinical decision support system. Our management decision support system we are using. Nowadays we are using clinical decision support system. It's very complicated. That is also based on your genetic and the clinical data. What is the clinical data is there? What is the genetical advantages are there? Based on the genetical structure of you. Based on that they are deciding that is used by CDSS, that is clinical decision supply system. This is also AI driven technology. And third one is biomarker. Biomarker, everybody knows nowadays we are using for cancer treatment these biomarkers. This is based on the therapies. In India, Chaco Memorial Hospital, we are using these biomarkers. And again, digital twin healthcare. Replica of patient of personalized treatment opinion. That is how the patient is reviewing the treatment. Based on that, we have to make the entire system that is called digital twin in healthcare. That is the replica of patient for personalized treatment information. This is also happening in USA. That is all of us program. That is all of US program. That is all of us program. That is for based on that. Now in US they are collecting the genetic and health data of all the citizens of US because they are going to digitalize everything. Based on the treatment, they are going to give the treatment. So precision management, I explained what is the genomics. Study of all genes in the organism to understand the disease risk prevention and treatment. This is the genomics what we are using. For that we are using WGS, whole genomic sequencing. Whole genomic sequencing we are using, that is the John Hopkins we are using the thing. Decoding your entire DNA structure with the risk predictions, they are doing this thing. And gene editing, even in the word and done we are editing whenever we are making a mistake, we are editing editing the word. Now they are using the gene editing technique, correcting the defective genes in the particular area, and they have to change that thing. That is called CRISPR. That is the program. Gene editing they are doing. And polygenic risk scores. There is predict likelihood of complex disease. What is the complex disease you may have in future? Like that they are, this technology they are using. Then cloud genomics platform, that is even Google Genomics and VG Genomics in China, they are doing very good for this cloud genomics platform. And I explained innovation in patient care. This is first one, precision management genomics. Second one is telemedicine and remote monitoring. Telemedicine in the whole world, Apollo's telemedicine system is the best, one of the best system in the whole world. Virtual consultation platform, AI for chatbots, cloud-based EMR integration, mobile health apps. These are all the four things we are using for telemedicine. Virtual consultation platform, because everybody knows about the telemedicine, so that I don't want to explain much on that thing. AI for chatbots, cloud-based EMR integration, and mobile health apps. This is Apollo, Teledoc USA, even China also they are using this telemedicine system. That is pick a good doctor. This is the China's telemedicine system. And another one is remote monitoring. Remote monitoring we are using wearables, IoT enabled devices, remote patient monitoring systems. These are all the things used in Mayo. This IoT enabled devices, that is predicts health retraction, any problems in the health. That is in Narayana Healthcare they are using that thing. So these are all the remote monitoring system we are using. The third one, AI diagnostics and treatment. What is AI? How AI is used for diagnosis and treatment? Machine learning and deep learning algorithm to interpret clinical data. Machine learning and deep learning algorithm to interpret the healthcare data, medical imaging AI, pathology AI, all the things we are using for AI diagnostic system. And national language processing also using in NHS. AI treatment, predictive oncology. Nowadays AI mostly they are using for oncology. Robotic surgery systems. Da Vinci is the robot in the world. That is that particular robot is used for surgery system. Cleveland Clinic is using that thing also. And the patient engagement and experience. That is the fourth area. Active involvement of patient in their own care journey, because everybody is, I told in my introduction part, everybody is focusing on not cure, care. So they are concentrating on their own journey. So nowadays patient protocols and mobile apps that are all introduced, AI or chatbots, gamification of health, that is you are maintaining your good health in the sense reward will be given. That is the gamification of health. Remote feedback tools, that is remote feedback tool in the sense when you are going to some other foreign country, some other places, you can give your experience, you share your experience in that particular hospital, like that the systems are going on. And patient experience, smart rooms, digital wayfindings, touch screens, everything is going. And this is actually, I explained where the particular system is accommodated. This four groups, they are doing very well in John Hopkins, Apollo and NHS anyway. I don't find any time to explain all these things. If you find time, you just go and see in your home. Next thing. What are the challenges we are having? Data privacy and security. It's very sure whenever we are doing innovation, we have to concentrate in all the things, because we have to be very careful on the data privacy and security. We have to be very careful on the cost and ROI, because the previous session we are talking about the fundings and cost and ROI we have to work out, and resistance to change. It is not possible for us to change very fast, because as I told you, clerical work they are going to do in the sense it will replace all the manpower. Clerical manpower will be replaced. It will create the client bill. It will create the final bill of your hospital. So that resistance you have to change. Then digital divide. Some of us won't are interested in involving all these things. So that also this is happening. And what is the future outlook? What will happen in future? Very fast I can explain. Actually in future, generative AI, it will come. Generative AI, what is the generative AI? AI can automatically summarize, structure and enhance clinical documents. Where artificial intelligence automatically summarize, structure and enhance your clinical documents. Some of the advanced models are there. DAX, Google Med, PALM and MedLM. These are all the Gen AI examples I can say. Then augmented reality is also you can know. Superimposed digital 3D images. Using that Microsoft HoloLens, Proximize, Medvis surgicals. These are all the people using this augmented realities. And third one is your digital twins for patient simulation. Virtual replica of the patient that integrates data from EHR, imaging, genomics, wearables and sensors. It will target all the images and will give the virtual replica of that particular patient. Digital twins for the patient simulation. For your understanding, I have to say once again, generative AI, augmented reality and your digital twins. These are the three areas. And one more important area you have to focus, that is the blockchain for secure patient data exchange. Blockchain is a centralized and tamper-proof digital ledger. Blockchain is the centralized tamper-proof digital ledger that record transactions securely. We have to record the transaction securely. For that we have to use the blockchain for the security purpose. So we are traveling from innovation to impact. I thank you very much.